of intellectualradio.com, its subsidiaries, or sponsors. Encouraging, educating, and empowering you into action. This is Warriors Talk with your host, Lady ReShell.
Hello, hello. Welcome to Warriors Talk with author and founder Lady ReShell, where we move away from awareness towards action. It is Health and Wellness Monday, and our topic for today is Women Pioneers in Medicine and Women's Health. We are live on Intellectual Radio. We just heard from Roman with the Drive at 5. Keep it locked right here on Intellectual Radio and allow us to feed your brain. I'm grateful for my sponsors. We have Mary Kay with Gloria Dotson, Allstate with Paula Kelly, and Emanuel Church of God in Christ with Pastor Michael Richardson, who has a special message for you.
Greetings, I am Pastor Michael Richardson.
And I am First Lady Anastasia Richardson from the Emanuel Church of God in Christ. We're located at 3058 West Van Buren in Chicago, Illinois. We are building upon a solid foundation.
And we're inviting you to join us every Sunday morning on Facebook Live at Emanuel Cogic at 10:15 Central Standard Time. And you can also view our videos on our YouTube channel at Emanuel Cogic-MR. Once again, this is Pastor Michael Richardson
and First Lady Anastasia Richardson, and we are from the Emanuel Church of God in Christ. We are building upon a solid foundation.
Awesome. I have some amazing sponsors. The quote of the day is, "A woman is like a tea bag. You never know how strong she is until she gets in hot water." And that's by Eleanor Roosevelt. Your trending topics are stimulus checks are rolling out, and here is what you need to know. Some Americans are already seeing the latest round of stimulus payments hitting their bank account. As the first batch of funds have been rolled out, the payments are worth up to $1,400, included in the $1.9 trillion, that is, COVID-19 relief package just signed by President Joe Biden. If you didn't see it yet, don't panic. A Treasury Department official told reporters on a call Friday that the checks will continue to roll out in the coming weeks. The paper checks are coming too. They're just going to be a little slower. And also the debit cards will be mailed out before the end of the month. So on today, you can start checking if your stimulus payment will be delivered and what date. Just go to IRS, get my payment online. Also trending is the vaccine eligibility will pick up this week. So far, more than 69 million people have already gotten the first dose of the COVID-19 vaccine, while more than 36.9 million are fully vaccinated, according to the Center for Disease Control and Prevention. But the U.S., according to Dr. Fauci, is still in a vulnerable place. COVID-19 is still spreading rapidly, and it must be tackled aggressively if we want to have a normal life coming soon. Even though the daily new cases have dropped since January, over the last couple of weeks, they have plateaued. When you see a plateau at a level of as high as 60,000 cases per day, that is a very vulnerable time to have a surge and to go back up. And this is exactly what Europe is experiencing. So those are your trending topics for today. And I am excited about the show today. I have joining me none other than our healthy solution expert with over 20 years experience as a family physician, and she is impacting lives every day. Welcome, Dr. Michelle.
Hello, Lady ReShell. How are you today? Hello, everybody.
I am doing well. I'm excited about the show today. We are celebrating women. This is Women's History Month, which is a celebration contribution of women in history and everything that they have done for the culture and society. It has been observed since 1987. So we are shedding some light and some sunshine on women today. We are actually going to talk about women pioneers in medicine, and we're going to talk about women's health. So if you have a woman in your life that you love, tag that woman into this show, share the show out so that the women can get this information. So
yeah, I'm really excited.
Yes, I
Great
am.
topic.
First, let me just say, Dr. Michelle, that you are our pioneer in medicine, right? You come on the show every single month and you give these not only gems, but this information that you give us that we can actually incorporate it in our lives and change our lives, not like the quick fix, but you give us information to where we can have this type of life that we can maintain. You know, sometimes we do these quick fix diets and then the next month we gain the weight back and we don't know what to do. But the information that you give us is very important to us having a life that we can maintain every single day. So I appreciate you as a woman in medicine. That's what we're going to be talking about in a few minutes. I appreciate everything that you do, the hard work that you have done over the last 20 years to make sure that we are healthy. So thank you.
Thank you, Lady ReShell, for your kind words. I love what I do as a, provider and a doctor in this space. I feel blessed to impact people's lives, just from my own experiences that I've had, with healthcare and, sick family members and how they were treated and what we can do to keep ourselves healthy. That's just what's my passion. And if I can share it with your audience, I love it. I love it.
Yes, well, we love it. So we're going to start. We have a 2-part show. We're going to talk about women pioneers in medicine, and then we're going to get over into women's health because we're dedicating the show since March is Women's Health Month, Women's History Month. We want to dedicate this show to that so that you can get this valuable information. So tag, share with the people that you love and bring them in. So Dr. Michelle, women pioneers in medicine. So who do we owe this to?
Yes, this is a great topic because, there's so many great women that came before me and being able to have the opportunity to do what I do today. The first female African-American physician became a doctor in 1864. And you can imagine at that time, Dr. Rebecca Lee Crumpler, what she had to go through with racism and sexism, to be a pioneer, to be the first one to treat, women and children. And that was really her passion. And, back then, I was reading about her, about all the racism and sexism, because back then they said that men used to think that their brains were 10% bigger than women. And so women really belonged in submissive positions. And so she really didn't get a lot of respect, but she persevered and wrote books and taught and just took care of her community. So she was really the first pioneer. But we've come such a long way from her to, Dr. Jocelyn Elder, who was the first female Surgeon General, African-American Surgeon General of the United States. We have Dr. Alexis Kennedy, who was the first female pediatric neurosurgeon in the United States. And just, to have the opportunity and hearing about these wonderful women, even as such, we are still, even though the African-American population is about 13% of the population, female African-American physicians are really only 2% of that, of all doctors in the United States. And right now, there's probably, I think, the statistic is maybe 900,000 physicians in the US, and there's only 2% of those that are African-American females. So, we call ourselves unicorns because we're a few and far and unique. But, we just are thankful for all of those trailblazers that came before us and set the example that we could do this.
Awesome. Leah left a comment. She says, thanks for sharing. Who run the world? Girls, you both are making an impact. Just like the women you are applauding. So we appreciate that. Awesome. So we're talking about
Leah.
Yes, we're talking about women pioneers in medicine. And Dr. Michelle just shared with us some of the women who helped kick this off, but she also expressed that we still have a long way to go when it comes to women in medicine. So if you're thinking about the career, if your children are thinking about the career, just know that we do need more women. Because I know a lot of times when I go to the doctor, I make sure that, my doctor is a woman for some reason. Like I had a male before, and when I would tell him things was wrong with me, he would think that they were all in my head, Dr. Michelle. He'd be like, yeah, that's just in your head. And I'm like, no, can you check this out? And he would kind of like brush me off. So one day I switched to a lady doctor, and he saw me coming, and he thought I was coming for him. And I was like, no, I'm here for Dr. Munoz down the hall. Like, you want the doctor to take you seriously. You want them to hear your concerns, and you want them to look into them. So sometimes when you have someone that looks like you and they're the same gender, maybe they can, sympathize with what you're going through, or empathize with what you're going through. So, come on, women doctors. We, like she said, we're unicorns. We do a lot of different things, and we need them in this field. So we applaud the ones who are doing it.
Yeah, and you're right. You like your physician to sort of look like you, because then you feel like you have automatic kinship, and it makes it easier for you to share what are really personal things that you have to tell your doctor. We give our Black men physicians a lot of love too, because they're doing a great job in that space, and really we have some awesome providers there as well. But absolutely, it's sort of what you're comfortable with, and we just need more of us in that space. So if you like science, I started on this journey back in high school. Actually, how I started, I always was, I liked science, I liked math, I liked those things. But back in high school, my counselor introduced me to a program called CHAMPS, which was at the Illinois Institute of Technology. And basically, it took some of students from the CPS, Chicago Public Schools. I went to Lindblom High School. Shout out to Lindblom. So they would take some students, and we would just go over the summer, and we would participate in some programs at IIT, take some classes, also did shadowing of doctors, right? So you can become what you see, right? So I would shadow a diabetes doctor in the community. I did some volunteer work at the old University of Chicago hospital on the children's unit. And so if you're thinking that you sort of like the field of medicine, I encourage you to find a mentor or ask your high school counselor about what programs are available. If you know a doctor in the community, you might want to ask them, because I've had that too, and I've had students sort of shadow me for a day, right? Can I follow you for half a day, especially over the summer, right? When you're not doing a lot, if your kids are in high school age, have them shadow a physician or whatever field, but in this realm, a physician for half a day, so they can see what it's like. What do we do? What's a typical day? Things like that. So, but having that experience in high school sort of let me know that is sort of what I wanted to do, and then just led me on this path to being a family doc. I thought I wanted to be a pediatrician initially after my volunteering at the University of Chicago, but then I decided I like taking care of the whole family. When you're taking care of kids, you also are really taking care of the adults, the parents as well. So just sort of shifted that way. But we need women physicians in all different fields. We need physicians who serve our communities because we know there are health disparities we've talked about before in our communities, and health inequities of, who's getting what diseases. So we need someone who has sort of been in the position of our patients to listen, to understand their full stories and stresses and all of that impact their health. And so that's what I try to do.
I totally agree with you. I can remember going in to meet my oncologist, and just so happens she's treated my sister. So she was like, oh, I remember your sister. So I know what type of cancer she had, what type of treatment she had. So it was kind of refreshing that, she kind of had that type of connection with her, that she can identify with, my sister, and she knew like the background of the family and everything. So that was kind of comforting to me. So, and when you was talking about shadowing, I was thinking about my 8-year-old. She wants to be a veterinarian, right? And I was telling her, what you have to do with these are animals. You have to deal with all. She's like, oh, I like dogs. I'm like, but you have to deal with all type of animals. It's not just dogs. So I would like for her to shadow one day just to see, because, when you're little, you say you want to be stuff, but to actually see what they do, I would like for her to do that and see if her thing would be the same. She still wants to be the same thing. So. Yeah, I think the shadowing would be a very good idea. I think a lot of people don't know maybe that is an option, that they can actually do that. So yeah, I like that. So we're talking about women pioneers in medicine, and we're talking to one, which is Dr. Michelle, and we're also going to switch over to women's health, because we know that women, we kind of like take care of everybody else in the family. And normally when we do that, we're leaving ourselves last, and we're out of energy, and we haven't been to the doctor because we're making sure that everybody's taken care of. So in order for us to take care of our family, we have to make sure that our health is in top shape. So we're going to talk about women's health and some of the things that we deal with on a daily basis that we really don't have to.
Yes. I'm excited about this topic, because you are so right that we do a lot for others, and sometimes we do leave our own health to the last thing, right? So not getting your mammograms, or not going for your gynecology visits, and not eating the right foods or exercising, and making time for those things, because they do impact your health, is really, really important. We talk about it all the time on your show.
Awesome. So the first thing that I wanted to get into, and I know we did a show on this before, is fibroids.
Yes. So fibroids is so common, uterine fibroids. So uterine fibroids are these small tumors that grow in the uterus that are non-cancerous. They're not cancerous, but they are a nuisance, right? They're abnormal growths that cause many symptoms. Some of those symptoms are pelvic pain. Sometimes it's bloating, irregular, heavy periods, constipation, depending on if it has distended your uterus. All of those things can give us clues to whether or not you could have fibroids. Fibroids are very common, and actually, in African American women, we think they're 2 to 3 times more common. And I think I was reading a statistic earlier that said that by the time a woman is 50, she's 80% likely to have fibroids. So chances are we know someone, right, who's dealing with fibroids. It's very common, tends to be more common in African American women. And we can talk about some of the theories about why that is. But really, it's important that we listen to our bodies and listen to those signs, because we sometimes will think that the symptoms we're having are normal symptoms because we've had them so long. Fibroids can begin to grow and give symptoms in the early childbearing ages. So you may think that, I've always had really painful, heavy menstrual cycles, and maybe that's just what I do, and that's normal. But if it's something that is persistent, and even having heavy menstrual cycles can lead to low blood counts, anemia, and other things, right? Like fatigue, shortness of breath, that we need to address as well. But it's important that we recognize those symptoms and act on them if needed, and not think of it as normal, because sometimes it's not. Sometimes there are things we can do to help you feel better to treat those fibroids.
So just because you've had them symptoms for a long time doesn't mean that it's something that your body should be going through. So when in doubt, speak out, get help.
Yes.
Do you have any things, Dr. Michelle, that we can do, like some do's and don'ts as it relates to fibroids?
Right. So the first thing, as I mentioned, is, well, there's certain things that should make you want to go and get it checked out, right? If you're having lots of pelvic pain or pressure, or you're having more bloating, or your abdomen seems more large, if you're having heavy periods, if you're having a lot of constipation or difficulty emptying your bladder, because you think about a fibroid can enlarge the uterus almost like you're pregnant. And so just like when you're pregnant, it can sit on the bladder and cause either frequency, right, or difficulty passing that urine. So those are the signs that we say, okay, let your doctor know. Sometimes we do nothing about fibroids. We don't necessarily have to do something if it's not bothering you. Many times I might find an enlarged uterus on exam, and the patient may say to me, yeah, I do have, some pressure, but I really don't have heavy periods. I don't really want to do anything about it. So we wouldn't. We would get an ultrasound, of course, to make sure that it is what we think it is. And if that's what it comes back to be, we might do nothing, or there's lots of sort of non-invasive treatment options that are available to women who have fibroids, from ultrasound heat treatments to hysterectomy on the other end. So lots of options. I'm sure there's some women out there that are listening that maybe have had symptoms or concerned. Please talk to your provider about it.
Don't suffer in silence.
Don't suffer in silence.
Yeah.
I was just going to say, because we had said that African American women are more likely to have fibroids, and some of the reasons, we're not sure it's a cause and effect, but we sort of see it more so in African American women. We think that there could be a genetic component. We think there's a hereditary component, because if your mom had fibroids, you're more likely to get fibroids. So important to share some information with your children as well. We think that vitamin D deficiency is correlated. But again, what came first, right? Because we know African Americans tend to be vitamin D deficient, increased stress level, which for whatever situations are in our lives, we can have more stress. And so there's lots of things we think, lots of high functioning women who are in powerful positions under a lot of work stress can have more likelihood of fibroids. So as you said, don't suffer in silence. If you have symptoms, get it checked out. Very important to make you feel better, and make sure that you're not getting anemic and other things that we can check for.
So you made a very important point, is sharing that information with families, because a lot of times we know we don't do that. So make sure that if you are a mother and you're suffering with that you share with your girls, so that, they can just take notice of their bodies and start talking to their doctor so that they can do something about it. Even if they don't have to do anything about it, the doctor would know that, this type of stuff exists in your family.
Correct.
Okay,
Family
so
history is very important.
It's very important. I think we tend to just downplay it because we don't want people to know what we're going through. Sometimes we have this shame about things that we're going through, and we don't want everybody to know our business, so we don't share. But when it comes to somebody's life, being threatened, all because of, oh yeah, this does run in the family, and so died from it, or so have it. Okay, why nobody told me this? Why didn't nobody share this with me? So that some of these things we don't have to suffer from, we don't have to die from, if we just open our mouth and share the information.
Yeah.
So we are live on Intellectual Radio, and we're talking about women's health. And Dr. Michelle is sharing some things with us that women normally go through. And she's also given us some things of what you can do as well. So we just got done talking about fibroids, and she talked about some do's and don'ts. She talks about If your mother has it, then more than likely you may have it. So start sharing that information. Another thing that I want to talk about that women, I think, are kind of in the dark about is heart disease.
Yes, yeah, we tend to think of heart disease as affecting mostly men, but it affects men and women equally. And last month was Heart Disease Month, but we talk about it all the time because it's the number one killer of individuals in the United States. And so it's important to understand that you're at risk and what can cause heart disease, right? So we know high blood pressure, which we always think of as the silent killer, because you have no symptoms till you have a heart attack or a stroke, right? I tell people to think about high blood pressure as a hose. And if you have a tiny hose that the blood has to go through, it's more pressure. The heart has to pump harder to get that blood through that tiny, tight hose. And so your heart starts to get enlarged over years. And the issue is you have no symptoms until you have symptoms, right? Until the event occurs. And I try to tell people that I'm treating for high blood pressure, that we're not waiting for you to get symptoms, because then it's too late to prevent. It's treating the disease now so we can prevent heart disease, prevent you from having a heart attack, needing a triple bypass surgery. I think I've told the story on here before about my mother, who was going along just as healthy, except for high blood pressure, until she started to not be able to walk more than a block with her symptoms, and had what she was complaining of as acid reflux. And that's the other point. In women, heart disease in women looks different than it does in men. We think, oh, I have, chest pain, I have crushing chest pain, that's heart disease. But for women who have heart disease, they can have different symptoms. They will sometimes complain of acid reflux type symptoms, nausea type symptoms, or just that I don't feel well, I just can't walk as far. And so we have to listen to those things too. If it's a change for you, address it. Why is that different? When someone tells me a symptom, my next question in my brain is, well, why is that happening? And I have to rule out all the horrible things that it could be. But she was going along fine, but it's just telling me about her acid reflux, and her primary care provider was providing her a whole bunch of acid reflux medications until I said, oh, this is not good. Let's get a stress test. And it went from there, and she ended up having emergency triple bypass surgery. She's doing great. But just to say that heart disease occurs in women, it might present to you differently. But if there's a change in how you are feeling, bring it to your provider attention. And please see your provider to get your blood pressure checked, which is the number one cause of heart disease, in addition to high cholesterol, or if you have some sort of congenital issue. But high blood pressure and cholesterol is where we need to focus our attention if you don't want to have heart disease, in addition to exercise, of course.
So getting those things under control so that it won't lead to that. So we do have some control over it. We don't have to just say, oh, yeah, people in my family have heart attacks. You're just sitting there waiting for yours to happen. No, there's some things that you can do so that you won't have that. And I like what you said about, if things are happening, if I'm having this feeling, why? Where did it come from? Let's get to the root cause of why this is happening.
Right.
All right. So our next issue is breast cancer.
Yeah,
something.
Yeah, I know. Not good old,
Right.
but yes, one in eight women get breast cancer. And so it's so important. I hate when I hear a woman won't get her mammogram because of fear, discomfort. The good thing nowadays, the machines for mammograms are much better. That they can get a better picture. The pressure is different than it was years ago. It's a few minutes of discomfort for comfort in your mind that everything is okay. And if it turns out to not be okay, we could take action, right? we talk about on this show. I always tell patients, regardless of what it is, I'm like, denial never cured a thing. Okay, so pretending we don't have something is not the answer. And it's just very important, because we know that the earlier, breast cancer is one of those things that the earlier you catch it, the best opportunity you have for cure and treatment.
I totally agree. Don't deny, but verify. So you just pretending you don't have it, no, it's going to have you dead out of options. So don't do that.
Right.
All right. And I know that some people will say, well, excuse me, breast cancer don't run in my family, but 85% of the women that are diagnosed, they don't have a family history. So don't just use that because it doesn't run in your family. Still get your mammogram, still get checked out.
Right. Yeah. We can't, genetic cancer, breast cancer is not the most common, right? We don't know what causes it. So good to know your family history, because your family history may allow you to get those mammograms earlier so we can catch things, because yes, there are people who get breast cancer in their 20s and 30s. And so that's where that family history is very important. But we know as you age as well, your risk for breast cancer increases. And it really doesn't matter genetics or not.
All right, so we're moving on to ovarian cancer and cervical cancer. I know some people think these are the same thing, but they're not.
Right, they are not. And this is a good point to talk about and to stress why it's important to see your provider, especially to get your gynae exam. So cervical cancer, we can detect with Pap exams, right? So when you go in to get a gynecological check, we can do a screening test, and based on your risk factors, that would determine how often you should get a Pap exam, a gynae exam, and we can see changes on the cervical cells that could lead to cancer. We know that the HPV virus, the human papilloma virus, can cause certain strains of that virus can cause changes on the cervix that can lead to cervical cancer. And so that is why we now recommend the HPV vaccine for all women and boys, girls and boys, to prevent you from ever getting that virus, therefore decreasing your chance of cervical cancer, which I've said for years, no one should be getting or dying from cervical cancer. If you are getting your Pap exams every year, or how often, depending on your risk factor, if your children have gotten their HPV vaccine, those things should really, really decrease the chance that you ever get cervical cancer. Ovarian cancer is just a difficult thing, because ovarian cancer, you just don't have like any good symptom to say, that is what it is. You could have vague symptoms like some pelvic pain, some abdominal pain. You may not have any change in your cycle, in your menstrual cycle, or anything. And so that is one that is harder to find. But when you go to your doctor, one of the things we do as part of just the regular physical is a abdominal exam, where we press on your abdomen and the lower abdomen. Sometimes we might feel a mass, or sometimes you might be like, ooh, I'm tender there, right? And which would lead us to other testing to look for that. Sometimes we can pick up changes in blood work that gives us clues to different cancer, depending on the white blood cell count and your hemoglobin count. But it's one of those tough ones to catch early. A lot of times, by the time we catch ovarian cancer, it's sort of advanced because it's just not an easy one to catch. But if you're going to your doctor and they're sort of screening you with questions, do you have any pelvic pain? Do you have any abdominal pain? Do you feel nausea? Anything, things like that can lead us to go down a list to figure out what that could be.
Wow. Okay, so let's go to that's a lot. Yeah, that ovarian, that's a lot. You know what was so funny is I can remember being in high school and we had to pick these papers and we had to pick a disease to do, and I picked ovarian cancer, and it made me sad just doing the research and knowing that a lot of women are diagnosed in the later stages because they don't have, and I'm surprised that now we still don't have specific testing for it, should I say.
Right, we don't have specific testing. Once you're diagnosed with ovarian cancer, we do have certain tumor markers we check by blood to monitor your treatment, but we don't use it as a diagnostic tool. And you're right, you would think now in the 21st century we'd have a better way. We just don't. It's just one of those horrible cancers. And when I think about cancer, I think about how can we help prevent that? And that's where we go back to the foods we eat, right? The things that we're doing. How are we decreasing inflammation in our body? Are we eating the right foods, fruits and vegetables and whole grains, and limiting red meat? Lots of cancers are linked to high red meat intake. And so we don't know that for sure with ovarian cancer, but it's always important, and we talk about this, it seems to go back every show, about what we put in our mouths really affect what happens to our physical state, right? What you put in gets absorbed. All that stuff you put in gets absorbed in your body. Some of the bad stuff leaves, but does it leave before it's done something to you on the way out? So important to think about what we put in our bodies.
Food is really our medicine. And if you think of it like that, I think we all would probably be healthier and have less issues. Yeah. Okay, let's talk about gynecological health.
Yeah. Yes. So we've kind of talked about that with the cervical cancer and the fibroids, but the other piece is for women is, do we know our anatomy? Do we know our bodies? Do we know what's normal and what's not normal for our bodies, right? If you're having an odor, a fishy odor, or excess vaginal discharge, you should be checking that out. That's not normal. You should be going to your provider. Are you having even urinary odor when you go to the bathroom? That should be checked out. And we talked about Pap exams. Those things are important to maintain, to check and maintain that our health is safe. But the other thing is prevention, right? So sexual health and making sure that you using protection and preventing any symptoms or diseases that can come about from sexually transmitted diseases. We talked about HPV and H. pylori, which not H. pylori, HPV, which causes cancer, to other diseases that we know that we can get through unprotected sexual activity, HIV and AIDS. I mean, there's things that we have control over, and we have to make healthy, good choices and teach our girls to make healthy, good choices, to know their bodies. I know, when I was in the office more and I would talk to young teenage girls about their bodies, and they didn't know their anatomy, and, they don't know what's going on. And we have to teach our girls about that and what's normal and what isn't.
When you was mentioning like the vagina, right? And the odors coming from the vagina. Like a lot of people douche and they think that, this is a way of cleaning out the vagina, or they're inserting, these over-the-counter things in the vagina. And they're thinking like, oh, okay, I'm curing whatever is going on down there.
Yeah. So there's normal bacteria that live in the vagina that keeps things in check. But then the overgrowth of bad bacteria is what leads to that fishy odor. But what can happen is, if you are douching often, you can strip the vaginal area of normal good bacteria, which then allows the bad bacteria to overgrow. Our bodies are great things. We've got good and bad bacteria, and it all is in alignment. But when we douche and we get rid of that often, the good bacteria, the bad bacteria can overgrow. And that's why we say that when you have that fishy odor and you have what we call bacterial vaginosis, it's not considered to be a sexually transmitted disease, bacterial vaginosis, because that bad bacteria can overgrow for a number of reasons, from the frequent douching that gets rid of the good bacteria, or if you sweat a lot, bacteria love more moist areas to flourish and grow. That can cause it as well. So the only time we really recommend douching, honestly, is maybe after a cycle, a menstrual cycle, if you want to do that, or once in a while. But if you're doing that consistently, it can sort of decrease your good bacteria. And in some people who are even prone to it, it can cause the bad bacteria to overgrow, especially if you're not drinking a lot of water and you've got lots of sugar in your system and all these other things that bacteria love. You can be more prone to that bacterial vaginosis.
Wow. If you are just tuning in, we are talking about women's health, and this is Women's History Month. So we are dedicating this show to educating women on different issues that we have with our health and what we can do about it. So the next issue is pregnancy issues.
Pregnancy issues. So sometimes when a woman is pregnant, it's a time to even be more in tune with your other health issues that you had before you became pregnant, right? Things like asthma or diabetes, which can become worse when you are pregnant. And even your asthma, right? You now have pressure of the uterus pressing up on your diaphragm. You can't take in deep breaths. That can get worse. So it's important for you to continue to use your inhalers and talk to your provider. Important to make sure you're getting prenatal health care, so that if you are to develop gestational diabetes, if you didn't have diabetes before, some people develop diabetes in pregnancy called gestational diabetes, that is taken care of, because that can be life-threatening to your fetus, as well as, gestational diabetes causes large babies to be born, 10, 11-pound babies to be born as well. So yes, so important to take care of your health. And then the other piece is depression, because the body's changing, hormones are changing. You can certainly feel, we think that all people feel just so happy when they're pregnant, but depending on the circumstances, the age of that person, the relationship with the father, it might be even a more stressful situation than it is a happy situation. And if you know someone, we talk about this with depression all the time, that the people around you have to notice a change, because you may not be able to notice the change in yourself, or you may not be willing to accept the change that you're feeling. So for us that are around just your friends or pregnant women, notice those changes that can occur in pregnancy, especially with depression and even anxiety, but depression, and acknowledge that. Ask them, how are you feeling? Because you seem down today, or I know that you're going through a lot, how can I help? Things like that are important to support each other as women when we're going through those things.
I can remember with my last baby, I was depressed. Like the other ones, I wasn't depressed. I just remember just, jumping back into my normal routine. With the last baby, I was depressed. Nobody knew I was depressed. I would, for the 8 weeks that I was at home with the baby, I would just like lay in the bed and cry with the baby, like right there. Like, I don't even know why. Like, I was just really depressed with this last baby. And I remember talking to my doctor and her asking me a series of questions and, wanting to put me on some sort of medicine. And I'm like, no, I'm just going to work through this. And thank God that I did. But I know what that feels like, especially, after you have that baby. It's like, oh, it's a relief. The baby is here. And then it's like, okay, the baby is here, and it's like, your body, it goes through something. So I can totally identify with that.
Yeah, and it's a physical change too, because your hormone levels, right? Your estrogen level is high, and your progesterone, all that's high when you are pregnant. You deliver that baby, and there is a whoosh decline in those hormones, and that steep decline in your estrogen levels after you deliver a baby puts women at risk of depression. We all, because we have this beautiful baby, we think, oh, we should be so happy and joyful, but beyond just that depression, it's overwhelming, especially as a new first time mom, as well. So I'm glad that you were able to come through that, but in some cases of postpartum depression, it can become so severe that people take their own lives and the lives of their baby. So important for us to have our antennas up when we know people are pregnant, and really ask the question, how are you doing? Because I know, being pregnant can be a happy occasion, but sometimes it can be stressful. Or if you notice a change in someone in your orb, speak up before it's too late, and just out of your caring for them, acknowledge that.
Yeah, because I think people just assume that, you're all right. So they don't, like, nobody ever called me and say, hey, are you all right? Are you doing okay? Like, I was crying the whole time. I dropped my girls off at school. Like, I would drop them off and I would go home and I would just cry the whole time. And then I would go pick them up. Nobody knew. And nobody even asked, even, they didn't even think to ask, like, is she okay? Like, what's up? So I agree with you. We, even if you don't, notice a change, just, ask how they're doing. Are you really okay? How's your heart? I heard people say that. How's your heart? Like, how's your heart doing? Like,
Right.
with
Right.
just, ask, just cry a little bit and ask, because you just never know. They may be at a vulnerable moment at that time, and they may just pour out to you to say, hey, I'm not doing good at all. This is what I'm
Right.
feeling. And sometimes that may be what they need to do, is to get it out. And then other people may need help. They may need,
Yeah.
further help.
Yes. And, in our communities, we tend not to talk about mental health, and we suffer in silence. And so it's important to remove the stigma of that. Women in general, we are strong, and we just push that down. Hey, I got to take care of the kids and the family and the house and everything else, and leave ourselves. We started with that, leaving ourselves to the end. But very important to be aware of your own emotions, your friends, and those family members that are close to you, and know that there is help, be it medication or therapy or prayer or whatever we can offer, but important to address it as we begin to remove the stigma of mental health and depression and anxiety in the community.
Awesome. And know that you're not alone. You're not the only one that's going through this. So don't feel like that you are. All right. I think this is probably going to be my favorite part. We're going to talk about some facts and some myths as it relates to women's health. And we kind of touched on this one, but for those who are just joining in case you missed it, the first one is a fishy vaginal odor is normal. I mean, you smell like fish.
No. No, not normal at all. Again, it signifies an infection, overgrowth of the bad bacteria. There's great treatment options for that. Again, drinking water and helping to flush your system can help with that, but definitely get it checked out, because you usually will need a prescription.
Awesome. All right. The second one is cranberry juice cures urinary tract infections.
Right. I don't want to say cure, but we do know a couple of things. We know that cranberries can acidify the urine, and bacteria don't grow well in an acidic environment. The best treatment to prevent UTIs is two things: drinking lots of water and flushing your bladder frequently. And then the other is not holding your urine, right? So sometimes, depending on where you work and you can't get to the restroom when you need to, you hold your urine, and that urine sits in the warm bladder where bacteria can grow. So two things to help prevent UTIs is drinking water and emptying your bladder regularly can help.
Awesome. All right. Number 3 is, if I don't have any symptoms, I must not have a sexually transmitted disease.
No, I treated many an asymptomatic STD infection. So important to know your partner's health as well, right? And to be safe and practicing safe sex with condoms and knowing your partner's health as well, because you can have no symptoms and still have an infection.
All right. Number 4 is menopause symptoms do not require treatment.
Menopause symptoms need to be treated. Now, you don't have, it depends. I like to say it depends on the symptoms, right? So we know that for some women, when you go through menopause, your estrogen level drops. Some women go through those hot flashes, night sweats, irritability for years. And it can really affect your quality of life, right? So I would say, if it's affecting your quality of life, we have great treatments for menopausal symptoms. Some women go through menopause and have no symptoms. God bless them, right? They go through and they have no or minimal symptoms. Their sleep is not disrupted. They don't have night sweats or anything. And that's sort of hereditary too, like how your mom sort of went through menopause. If it wasn't a surgical menopause with a hysterectomy or anything, can really get some clues to how you will go through menopause or what age you may go through menopause as well. Some of those things happen around the same time. So we don't have to treat menopause symptoms, but if it's affecting your quality of life, then we should.
Okay. Number 5 is the vagina is permanently stretched during childbirth.
Is permanently stretched during childbirth?
Yes.
Okay. So not so. Okay. The muscles can sort of not regenerate, but shrink back down after childbirth. So a myth.
Definitely a myth. All right, Dr. Michelle. So what are some words of wisdom that you would give to women as it relates to our health?
Yes. So as women, we started out talking, Lady ReShell, about how we tend to put ourselves last and we put everyone first. So I'm challenging all women out there today to put yourself first and not feel guilty about it, right? If you are feeling a certain way, be it physically or mentally or emotionally, to take charge of that and take care of your own health. That there are things that we can do to stay healthy and prevent serious disease like heart disease and strokes, like we talked about. So my word of wisdom is put yourself first because you're worth it.
I love that. Thank you so much, Dr. Michelle, for your amazing words of wisdom and just continuously sharing and educating with us on making better decisions so that we can live a healthier life. So I appreciate you. So thank you so much.
Thank you so much for having me. It's always fun to be on your show. So I look forward to it.
Awesome. So I will leave you guys with these words of wisdom. They come from Oprah Winfrey. And she says, think like a queen. You are not afraid to fail. Failure is another stepping stone to greatness. So thank you for tuning in to Warriors Talk. Meet me next Monday at 6 p.m. right here on Intellectual Radio. As always, Warriors Talk is changing lives one warrior at a time.
Thank you for listening to this week's edition of Warriors Talk with Lady ReShell. To find out more about Warriors Talk, follow at Warriors Talk, the number 1, on all social media outlets, and Warriors Talk with Lady ReShell on YouTube. Please join us next week and every Monday evening at 6 p.m. Central Standard Time on intellectualradio.com for Warriors Talk with Lady ReShell, where we encourage, educate, and empower you into action.